Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today, my guest is America's dental technology coach, Dr. Marty Jablow. Welcome to the podcast, Doctor.
Hi, Matthew. Thanks for having me. Great to be here and looking forward to having a nice discussion.
Yeah. Well, I didn't really get into all of the things that you have achieved uh, in the intro, but you've accomplished a lot of things to this point in your career, and I often like to ask people what it is that kind of inspires and drives them forward. So, what is it that keeps you going?
But what keeps me going is having fun, I guess, is diversity in what I do. So I'm a general dentist. I practice in Woodbridge, New Jersey. I've been doing that for a long time. You see, you got gray hair, prove it. Um, and that was what I thought I was going to be. And then, later on, I got into lecturing and I got into product development and I've gotten into a whole bunch of different things that don't really necessarily equate with just being a dentist. And so I think that one of the great things is that I can do multiple things and, but I'm still a dentist. And, I always say to people, whatever you're doing in dentistry, well, we're still all dentists and we're still treating patients. And that all stays the same. It's all the other things that are around it that can either make dentistry simple, fun, or difficult.
Yeah, I always find it fascinating to kind of see the journey that people take in their careers. It does start off looking like it's going to be one thing, and as you go, different doors open and different things prove to be interesting or exciting and different ways of helping people. So I think that's kind of a natural evolution if you actually just kind of ride with that and kind of keep locating where those places of passion are. So that's great. Uh, this is the Truth Behind Dentistry podcast. So, are there any in this journey of yours? Are there any insights, any sort of discoveries, or things that are standing out to you as something that would be helpful for other clinicians?
Oh yeah, there's something that's really the thing that I think the greatest part about dentistry is what we're really going to call freedom. You can make it do whatever you want. Uh, I never expected this journey. I went from, just being a kid who tinkered with technologies forever. Building well, but before I even did that, I was doing all, my mother used to say, take the TV apart. Which wasn't the safest thing in the world, and put it back together.
Yeah.
Then I, went through college, didn't have any computer backgrounds, and when I first got into dentistry and we started putting computers in, I was building them. And so, I've always been in the technology part, and that's why they call me America's dental technology coach. But through that, then I was able to develop other skills. And it's not just dental skills. So I was on the forefront of a lot of different dental products. I call it the bleeding edge. And I would tell most people you don't want to be there unless you're very comfortable with what that is.
Mhm.
But you don't want to be the late adopter either. And so I was always an early adopter, digital cameras, intraoral cameras, lasers, all that kind of stuff. And that's kind of where my careers started. And then, ultimately, the internet became something. Met my lecture partners, Paul Feuerstein and John Fluke. And then we started doing things together and apart, and we've been doing different dentistry things for a long time. Everything from, KOL summits to product development, and they're editors of magazines. So, I had a whole very big, broad, different view of dentistry than going to an office. We did all these things and it allowed me to see different parts of dentistry that I had never thought about. And what is the business of dentistry? Well, it looks different depending on where you sit. If you're sitting in a dental office, then it's probably your patients and Henry Schein, Patterson, Benko, that kind of thing. If you're sitting in a KOL seat, key opinion leader, now you've got a little different thing of what that dentistry is. Or if you're, a consultant. So there's a whole broad range of things in dentistry that people can do. And you just have to decide if you want to do them first, and then what your niche may be. And does that fit your lifestyle? Because you got to give up something to get something. And that's why I have a lot of people who would talk about being a KOL, and I go, how much time are you willing to take from your family?
Right. Yeah.
Because it does take time.
Yeah. That's good. And I appreciate that. And I think it's good for people younger in the profession to be able to hear from a variety of different voices who have been on this road for a while, to hear that yes, there's all kinds of possibilities out ahead, but likely they're not going to see all of those until they begin to go through their career and clarify what they love, what does really matter to them. So I love possibility and just being able to explore, but not necessarily having the pressure like you have to know and figure all those things out in any given point in time either. So I think it's kind of an open
Well,
invitation.
yeah, it's experience. And unfortunately, it takes time to get experience,
Yeah,
the good and the bad.
yeah,
And then it's what you make of it.
yeah.
So, being a key opinion leader is one thing, being a dentist is another, being a product development and all that. Everyone is at a different hat that you get to wear. And, I always said, well, maybe I should go back to school and learn, get my MBA or get, all these other things. I don't have the time. That's the
Right, right.
first thing.
Yeah, right.
And especially when my children were young, I sure didn't have the time. But now, I kind of did a lot of it through just learning from others around me.
Right.
So yeah, like everything is a mentorship really in life.
Yeah,
And, there's very few of us who just do it alone. So, you find those mentors, find those people who came before you, see if they can help you. I mean, those are all of the real benefits
yeah,
of what I call the overview of dentistry.
yeah. No, that's good. Um, so you are a dental technology coach. So maybe for a minute you can elaborate on a little bit more about what that looks like on some ongoing basis.
So that kind of evolved too. So the original part of that was that I was going to coach dentists on how to integrate technologies into their offices. And I did a little bit of that. And quickly that morphed from that to something more. And that became my involvement with different dental companies into getting into product development. What do you have to do and make sure the thing works properly? Are the buttons in the right place? Are they, all these kind of things? And then you got to bring that to market. So then there's an education component to it, and there's a marketing component. And I'm not necessarily an expert in all of those places, but I've done it enough that I can actually say, hey, here's a suggestion because I've seen what's worked and what's not worked before it. So with that, I think you get to see, you get to evolve. That's probably a better word, not see, you evolve. What we started at doing, like I would never have told you in a million years I'd be doing what I'm doing when I thought about being a dentist, because a dentist was somebody who went to work and fixed teeth and went home.
Yeah,
And now that's just that's a piece of what I do, not all of what I do.
yeah,
And I'm still a dentist.
yeah, yeah. And so maybe that's a good segue into an event that we want to spend a little bit of time talking about that's coming up. February 19th, excuse me, in Chicago, that you are co-chairing. It's called the Dental VIP Summit. So maybe you can tell us a little bit about kind of the purpose of that summit and kind of what's it going to entail?
So so I looked to start this about a year or more ago. And we ran into some technical issues, and that was, we kind of got pushed to the side and didn't happen. And then I met Darius, and I had a conversation with him, and I brought in the other person, Craig, who's involved in this. And the whole idea was to bring both stakeholders, new companies, startups, KOLs who are existing KOLs, and maybe people who want to, and bring them all into one place to try and, networking opportunities, investment opportunities, kind of bring the whole package together. I mean, that was really it. And that to me was the purpose of the summit. And with that, we've had a lot of traction already, I have to tell you, from all over the world, which was really more surprising to me than anything else. We decided to do it in Chicago before the midwinter meeting because we thought, that's going to be it. And everybody shows up and the industry is there. So people didn't have to make a special trip from Europe, from California, wherever they may be coming, because most of them were coming there anyway. So they may have to get an extra night there in the hotel, or they can fly in the morning because this is going to be on February 19th at the Intercontinental Hotel from noon to 6 p.m. or so. And we're going to just give everybody the opportunity to see, rapid fire presentations on all different things, that all different technologies from AI to salivary diagnostics, advanced optics. I mean, we've got a lot of companies that are coming in who want to showcase their wares and their startups, and they're looking for investors, they're looking for KOLs, they're looking for all these people, and we want to try and put it all together at the meeting where they're all going to be anyway. And so, the discussion with Chicago, we're over at IDS in Cologne, which was going to be a little more difficult for us stateside folks to pull off. So, we're here in Chicago, like to do it in other places eventually, but we're going to start the annual one right here now in Chicago in 2025.
That sounds great. So for those that sounds interesting, and are trying to picture even more what this is going to be like, is there something that you would say that this will be like, or is this really something that you see as quite unique that hasn't really occurred like this before?
Well, everybody, there's been like, dental shark tanks and investment webinars and all that stuff, which most dentists don't even see or are part of.
Right.
But with this one, we're trying to do something a little different. We're trying to help all the people in this space. So we're going to be talking about how you raise funds. That's not something that most people when there's dentists many times who's the decision who goes, do I have a product I think I want to do? What do I do with it? I've got it now. What do I do? What's the regulatory process? What's the financial process? So we're going to have roundtable discussions on some of those matters. Then we're going to look at some of the technologies that are now expanding, really, like AI, which is exploding in dentistry, and talk to those people in the companies, the CEOs, the people who are driving this technology. And with that, we're going to be able to then have another round where there's investors and companies who are going to give their 3-minute elevator pitch, that. So the whole idea is to try and bring every piece of this, the dentist KOL or future KOL, the investors, the startups, anybody who's got a piece in any of that all together at once for the whole part of networking. That was the whole thing. We're not trying to make this a big CE event. We're not trying to do anything like that. We're just trying to bring the people together so that they can benefit. That's really it. I mean, can we all just find what are those technological advancements that we're going to need in 2030? I mean, because you can't bring most products aren't, if you're deciding to bring it to market in 2025, unless you're pretty far along the line, it's not happening. So we want to have mentorships, things like that people can then have other people that they may be able to go to help them through the obstacle course of bringing a product to market.
Yeah. Yeah, that sounds excellent. So, I mean, as you're saying all those things, I'm thinking that everybody who is at Chicago Midwinter really would benefit from being there. I'm trying to think who wouldn't gain something from participating. Is there really anybody that it wouldn't make sense for them to be there, or is there anybody that you might want to say should absolutely make sure they're there?
Well, so there's a big difference between that. Those who want to be on the cutting edge, not necessarily the bleeding edge like me, but even on that, if you want to be that person, if you think you're that person, then yes, you want to be there. If you're the dentist who sits there and goes, I'm going to do it the way they taught me in dental school. And, if when I call that bell curve, if you're, the lagger on that bell curve because you just don't want to either invest the time, effort, or money into it, then maybe that's not the way place for you to spend your money at. More importantly, spend your time. Forget the money part. It's the time. So yes, that would be the person who shouldn't be there, but those people who really want to be on the cutting edges of what's going to happen, not necessarily today, but in the years to come, those people want to show up. And like I said, it can be the dentist who thinks they want to be a KOL. It could be the KOL now who wants to see what's going on. And then it's the startups and investors and all these business people who've been CEOs of other companies and successfully, brought products to market and then sold and made their money and decided, well, you know what? I'm going to get back in the game because the game's a lot of fun.
Yeah. Yeah.
And with that, that's really what we're looking at. We're looking at the opportunities for dentists to be in KOLs, for those industry executives, for those startups, everybody who's involved in those processes, we'd like them to be there.
Okay, fantastic. We'll make sure that we include the details about the event along with the podcast notes. So, but anything you would want to say in terms of the first step someone should take if they need more information and they're trying to decide, or want to get in contact with someone to discuss it, what's the best thing for our listeners to do?
So the easiest thing, so again, it's going to be February 19th. That's the Wednesday before the start of the Chicago Midwinter meeting. You don't have to be there in the morning. It's starting around noon. There's going to be a lunch, and then we're going to try and make this go from like 1 to 6. There'll be some breaks and networking opportunities. So, if you need to meet somebody, you can try and do that at that opportunity. Best place is dentalvipsummit.com. That's where you can register. If anybody wants to get a hold of me and talk to me about it, it's Marty at dentaltechnologycoach.com. Happy to engage you, no matter where you may fall in that spectrum. And if not, Darius or Craig or all of us will get together and see how you may be able to fit into this meeting. And, then it's just a matter of participation.
Yeah.
You can be proactive and jump in, and you can then go try and be reactive and go, should have been there.
Yeah. Well, excellent. I appreciate your time and coming on and sharing a little bit about you and this event opportunity. Is there anything else that we didn't say that you'd like to leave us with as we wrap up?
Yeah, the only thing I'd want to say is whether you show up to this event or not, the future is bright. It's different. Dentistry's changing, and the future is just going to be completely different. I go back a long time now, and what I thought was state of the art now looks barbaric. And what we're doing today will somehow 20 or 30 years from now look barbaric too. So, where do you want to be? You want to be on that edge where everything is going and you don't want to be behind. And that to me is the big thing, is the future always looks great. And somebody once asked me, when's your best day? And my best day is always tomorrow, because I can do something with that one. I can't do it. Can't do a lot today.
That's great. Well, your enthusiasm is infectious about that, so I appreciate it. I think those are good words. So it's been a pleasure to have you. Thank you for spending some time with us, and look forward to connecting further.
All right. Thanks for having me, Matt. It was a lot of fun, and hope to do it again sometime.
That sounds good. So this is Matthew Norton. This is the Truth Behind Dentistry podcast. I've been with Dr. Marty Jablow, and hopefully you will follow up and take a look at the event, and we will see you on the next episode. Thank you.